conversation with Ron Werft. And I'd like to introduce myself. My name is Richard Beswick. I'm the Chief Research Officer for Cottage Health and also the VP for Research here. And I will be your moderator and host today for our conversation with Ron. And before starting, I'd like to do a little bit of housekeeping for the Sustainable Change Alliance by just kind of stating that the Sustainable Change Alliance is an impact-oriented, member-based, not-for-profit educational group. We are focused on impact investment, which we define as bringing financial and other resources to double, triple the bottom line of organizations that are trying to address big social, environmental, or health-related issues, and trying to do that in a sustainable manner. Some of the organizations that we support are actually not-for-profit, and some of the organizations that we support are for-profit. And also, I'd like to give a little gratitude to some of the sponsors and the members that have joined today. First of all, I'd like to go back to our founding sponsors, Argyle Capital Partners, Maps.com, and UBS. Platinum sponsor, Nixon Peabody Law Firm. Our gold sponsor, JP Morgan Chase. Silver sponsor, Bashir's Insurance. And then really kind of jump into this. So the way that this is normally set up, as you guys know, is that we try to do this as a conversation between two individuals. And today, I am excited to be talking to Ron. It's not like I don't talk to Ron frequently, but I'm always excited to talk to Ron. So, but let me do a quick introduction of our speaker. Ron Werft has led Cottage Health as president and CEO since 2000 and has been with Cottage since 1987. He is a graduate of UC San Diego and holds a master's degree in hospital and healthcare administration from the University of Minnesota. Yay, Minnesota! We're all Minnesotans. Under Ron's leadership, Cottage Hospital and Goleta Valley Cottage Hospital have been rebuilt and expanded to meet rigorous earthquake standards, and both hospitals have consistently achieved a rating of 5 stars from the Centers for Medicare and Medicaid Services. Ron was also recently elected to the Board of Trustees for the American Hospital Association, Washington, D.C. The board is the highest policy-making body of the AHA, which represents nearly 5,000 hospitals and other providers throughout the United States. So we are absolutely excited to have you here, Ron. We're absolutely so happy that you are going to talk to us today. So I am going to allow you to say a few words about Cottage, if you don't mind.
Thanks, Richard. Nice seeing you again today, since yesterday. Thanks for the invitation to SCA and to all of you for taking the time to call in. It's nice to even virtually be with you again. A lot more fun in person, so I know we all look forward to those days. Look forward to this conversation, Richard. This has been, I would say, it has been and continues to be the challenge of our professional careers, we have a lot of work still in front of us. So look forward to the conversation.
Great, great. So let's really talk about Cottage and how is Cottage really holding up during this time of the pandemic?
First of all, I would say I've never been more proud of the people, the physicians, the nurses, the caregivers, the environmental service workers, the dietary workers. I mean, it's been really incredible to see the professionalism, the esprit de corps, the way in which this has been attacked and addressed by all the people at Cottage. I know you'll have other questions. We'll get into specifics on this, but I'll just give you all a sense of our healthcare heroes. The weekend, we've been preparing for a while, but the first weekend when the first COVID positive patient was admitted, and we had just set up negative pressure units, an intensive care unit for ICU care, those who needed it, and a medical surgical level unit. A lot of us were here, and I put on the PPE and went into these units and expected to see people who were concerned and perhaps frightened as well, even though they've been through the training and were prepared for this. And what I encountered that very first morning when the patients first started getting admitted was confidence, competence, and the first two nurses I spoke with and simply asked, how are you doing? The first one, the answer was, living the dream, baby. And the second reaction that I got from another nurse was, we got this. And then a third actually said, we've been through pandemics before, we've been through disasters before, we're totally ready. So I just wanted to share that because that is, I know you've all celebrated healthcare heroes, the whole country has, but there's, they certainly deserve and earn that. So Cottage, just in answering your question, I would say has, I've never been more proud of being associated with the people here.
So it sounds like our heroes within the hospital were pretty much ready to go before the actual pandemic really started in this particular area. So are there any additional steps that you could kind of inform us of that Cottage might have taken, or any changes that we did prior to the actual COVID numbers starting to rise?
Yeah, I'll refer to a number of things. Hospitals do disaster drills and a couple times a year, and we do those sometimes county-wide drill, sometimes with law enforcement, depending on the nature of what we're rehearsing. And so, unfortunately, at Cottage, we've had experience with disasters, quite a number of times, whether they were mass shootings or other Isla Vista tragedies that we've experienced, to, of course, the more recent fires and debris flow of our very recent past. And so I think that part of the preparation is having a system that can very quickly pull together and open the incident command center. And we all know what our roles are there. We have a chief operating officer who leads that still every single day. We opened the incident command center in early March, but we had been meeting as a leadership team and talking about this since late December, early January. And so we stay in very close contact with our infectious disease, Dr. David Fisk and Dr. Lynn Fitzgibbons. We are so blessed to have them here in Santa Barbara. They are with us every single day. And the other preparation I would mention in terms of would be facility related. You mentioned in the introduction, Richard, that we recently rebuilt our hospitals. And when we did that, we built them in such a way that we could do a number of things. First of all, we have UV light filtration and UV light for all of our air handling units in our hospitals. We built, I believe we had 26 designated isolation rooms, which were negative pressure, scattered around the hospital for different specialty units. But importantly, we also built it in such a way that we could fairly quickly convert entire units to negative pressure. And that allowed us to cohort the intensive care patients in an ICU where there would be no other patients needing ICU care, and it was safer for patients. We were able to ask staff who were willing to sign up for this to work in those units. That was not an issue from our intensivists and our nursing professionals. Day one, ready to go. But we could do it in a very safe way. And in terms of protective equipment, by doing that, it saved a considerable amount of PPE because they are in protective equipment all day in that unit, in those units, one med surg, one ICU. Whereas if we had if we didn't have that capability and we put these patients in those scattered isolation rooms, every time every individual went in and out of that room, they would have started over on PPE. So I think those are just some of the things that come to mind. We have Xenex robots also that do ultraviolet terminal room cleaning. We've added a lot to that inventory over the years. And I guess the other thing is that while we did, and this is going to be a lesson learned for us, while we did rely and assume that the state inventory and the federal cache of protective equipment would be there for something like this, we also significantly increased our own inventory of PPE relative to a lot of other hospitals that I've talked to. And so I think Susanna Shah and others who really help us prepare for disasters were ahead of the game on that. We have a lot more ventilators than we normally need. And so while it was very possible, and I suppose still is possible, that we'll need more ventilators, we have a solid inventory there. So I'm sure there are other things, Richard, but those would be just among the things that occur to me when we think about how we prepared. Equipment, training, and the culture, I think, in I hope every hospital, but certainly our hospitals is one of what more can we do when it comes to the part of our doctors and nurses and others who take care of these people.
So it sounds to me like what you're saying is that Cottage was fully prepared, and we started preparing for this 10 years ago when we decided to rebuild the hospitals and be able to make all these changes almost immediately. So that's wonderful.
Yeah, I wish it was only 10 years ago. Actually, that process started in 2004. So,
okay, all right.
You're newer to the game here.
All right. So you mentioned PPE. Is there still a need for PPE in the hospital? Is there still a shortage?
Yeah, that's a very good and a little bit of a complicated question. We're in very good shape right now, and thanks to a lot of people in Santa Barbara, we're in good shape. And I know this whole conversation's about partnerships and community support, and look forward to talking about that. It was heroic in terms of ramping up our PPE needs. So when the things that you've all been seeing in the media and reading, the critical factors in managing this disease are protective equipment for our staff and testing. And so I'll touch on both of those. Today, we have good inventory of a long list of protective equipment. And we're talking about gloves, isolation gowns, surgical masks, N95s. We've all read so much about N95s. By the way, there are a number of varieties of N95 masks, as there is other equipment in this regard. And also, you've probably learned what a positive air pressure respirator is, a PAPR, and part of that, it's a kind of self-contained hood that has positive pressure and helps cool for people who are in these for a long, long time. And they have a face shield that's integrated with this PAPR system. In addition to that, there are just face shields that are used for staff who are involved with aerosolizing procedures within the facility. And so we've got we look at it every single morning. We've got an inventory with current burn rate for each of these items, as well as pharmaceuticals, drugs in short supply potentially. And we look at this every single day, and we know how many days inventory do we have on stock, and when's the next shipment coming. And so, long answer to your question, but we're looking very good, well into the summer right now. In some areas, we've got 1,000 days or more stock on hand in some of these categories. N95s are still a big challenge for us. So I know of hospitals in California that have 0 N95s that are of the 1870 variety. And the 1860 variety is different than the 1870 variety, and all of these require fit testing. And so you can't just talk about N95s and answer the question. At Cottage, our staff are in very good shape right now, but I say that with a little bit of hesitation only because we don't know, we don't have a good line of sight for replenishing stock in some of these areas after July or August. And that of course leads into, when will there be a second surge or increasing demand for this protective equipment as our communities begin to open up.
So as you bring that up, is there anything that the community can do or any of the Sustainable Change Alliance members that they can do to really help Cottage at this time point?
Yeah, thanks. Let me, if I could first say what the community has done. It's
that'd be great.
Really remarkable, Richard, on so many levels. And so while we're talking about PPE, I'll focus on that. One of the great aspects of our incident command center, which we keep thinking we can probably not have to meet every day, but that's never true. A lot of things change on almost a daily basis. And one of the great things about this approach is that we've got people with clearly defined roles and responsibilities. And I know some of you know Lisa Moore on our staff, who was the lead on this whole partnering with our community on protective equipment, because you may be aware there were news reports about 950,000 N95 masks that arrived from the state disaster inventory, and nobody knew this. We were all pretty excited about when the shipment came into direct relief, and they were just helping with the accommodate us. This was not anything related to any responsibilities of direct relief, except they were being helpful. When we received those masks at the hospital, these are, I think, 17 pallets of masks was our allocation, and we thought this was like the best possible thing that could happen until we opened them and learned that they were made in 2003, they had expired, and even worse, when you began to put one on, as soon as you stretched the elastic at all, it was so brittle that it just kind of disintegrated in your hands. So these were almost 1 million masks for our hospitals in the county that were useless. And so this is a lesson learned for us, I think, going forward. We're kind of on our own, and we really need to continue these incredible relationships that have occurred so quickly. UC Santa Barbara, Dr. Eric McFarland, an MD engineer at UCSB, has been instrumental in developing and creating and networking us with tech companies, and also designing how we can do this ourselves. And so there was one day when we looked at the inventory on PAPR face shields, and we were down to 8 of these. And within, I think, about 2 days after that, we had 1,400 of them, all manufactured locally, because UCSB engineers, Eric McFarland in the lead, immediately, we had somebody donate a 3D printer. One of our donors to the hospital, support of the hospital, donated a 3D printer, and then we partnered with local tech firms to manufacture these. Basically design them, build them, test them, and so that's been huge. And I'm just going to show you all, because it's too long to go through. This is the list of all of the companies, and it doesn't stop here. It goes over to this side. I'm seeing if you can see this. This is the list of all the companies And here's the list of the companies and quantity in stock at Cottage right now that we wouldn't have if all these local companies hadn't just like jumped into this thing. And so the community has been unbelievable. I also, this is one that didn't pan out, only because we didn't need it. Very early on, I got a call from John McFarland of Sonos fame, who was already talking with engineers at UC Santa Barbara and with Anderson Construction, who does some work on our projects here at the hospital, about designing and building a negative pressure mobile ICU that we could put in the ER parking lot. And so a lot of work went into this by a lot of people. And this was the same time that we were studying and working with the county on what are we going to do for surge capacity outside the walls of the hospital. And so it wasn't clear to us early on that this wouldn't be a godsend for us. So a lot of work went on. And the point I want to make is that not every one of these efforts are going to wind up, being front page news because it actually worked out and was needed. But the fact that privately owned businesses, publicly traded businesses, UCSB engineers, and doctors and staff like Lisa at the hospital got together and solved this thing was extremely gratifying. So long answer to your question, Richard, but again, when you say, well, what can the members of SCA do? I think that we need to move on from certainly relying on state or federal disaster caches for any kind of disaster. And we need to be very thoughtful about what we can manage in our own inventory and make sure that we're replenishing that, just like we do scheduled maintenance on all of our equipment. We do that for supplies too, of course, but we need to increase what we can keep on hand. But I think it's clear that when you get into something like a global pandemic without a vaccine, nobody knows how long this is going to go. And so the ability to have agreements with local companies to be able to manufacture these quickly, once we know we're down to 90 days stock, that's something that we're kicking around here as a lesson learned. And I just put it out there. The others on the call may have different ideas or better ideas than that, but I do see that these partnerships with local businesses, it could be a very important part of our disaster planning and pandemic planning going forward.
Thank you, Ron. That's great. Many lessons learned as we go through this. And, most recently, the hospital has opened up for other treatments across the hospital. So now we're seeing various patients in various areas. And a lot of the community is asking, how safe is it for non-COVID patients to come to the hospital? Can you give me a little update about that, please? Thank you.
Yeah, I can. I'll tell you that the line that we use around the hospital, and we're all here, most days. The line we use around the hospital. And I'm going to pick a particular store without. Okay. I ask you to use it generically, but it tells you where some people shop, I guess. It's like people here who are in the COVID units or outside the COVID units say it's safer here than Gelson's. And so no reflection on Gelson's, they're doing a great job. But the reality is that we haven't had a single evidence of a transmission of COVID from a patient to any of our caregivers, physicians, nurses, those who clean the rooms, zero transmissions. And also the opposite of that is true as well. We've had healthcare workers who have become COVID positive, but the vast majority of those were returning from abroad and certainly didn't catch it at the hospital. So I think you asked about non-COVID patients. We do have a very careful separation, and we've been taking care of patients throughout this entire 100 days now with COVID positive patients within the hospital, but I think we got as high as about 22 COVID positive patients in the hospital in beds. And, you know, we have today, we've got 6 COVID positive patients in those COVID isolation units. And we have 225 non-COVID patients being taken care of like they always have been everywhere else. So just to reinforce it, you know, we talked about the building and the negative air pressure flow. That's really important. But also, you know, we did cancel all elective surgeries. We're now bringing those back. We're scheduling cases. We're up to about 80% of our usual operating workflow right now, close to 100% at Goleta Valley now, with a lot of orthopedic cases that were a lot of pent-up demand there. But this may change soon. The public health officer has ordered some new, more flexible guidelines around visitors, but we still are very restrictive on visitors in and out of the hospital. I think that is going to change quite soon to relax that. But I won't go through the disinfecting and cleaning protocols that we have. They're all signed off by our infection control physician directors. We're pre-screening every single admission to test for COVID to make sure that if they test positive, that they are cared for in a isolation unit, and if they're not, they're cared for in a non-isolation COVID unit. We still do require masking of all of our staff and any, certainly any visitor, and we have had some visitors on these narrow restrictions come in, but we're still masking everyone. We ask, I'm asked as somebody who comes into the hospital every day, 7 questions every single morning related to symptoms, and I don't get past the front door unless I say no to all those. That's true for every doctor, every nurse, everybody who comes into the hospital, and we're doing temperature checks also on everybody who comes into the hospital. And if you don't pass both those tests, you're going to be referred for care, but you know, you're not going to come into the hospital and provide care. Yeah, I think those are the main issues. I will tell you, I will ask for all of your support and advocacy in helping people feel confident and comfortable in getting medical care right now. The national surveys that we've looked at the American Hospital Association show that there are only 8% of those surveyed answer that they are now comfortable coming to a hospital for care. They also say that 45% say that if we have confidence in our hospital and my doctor or my hospital says the sorts of things that I've just said to all of you, then we feel more comfortable. Some others have said, we're not going to feel comfortable until there's a vaccine. And so I have to be honest, when I'm always honest, I'll tell you honestly that I personally feel much safer walking the halls of this hospital than I do pretty much any place else in town.
Well, it sounds like Cottage is doing a lot to ensure the safety of everyone that comes into the hospital, including all of our patients. And you know, Ron, you missed one thing. I have to make sure I bring that one up. We're sporting a new chic look. You know, it's not like we normally when you come to Cottage, all of us have on ties. I have on my bow tie. Most people don't even recognize me anymore, but you know, it looks like all of the executives or the folks in the hospital are not wearing ties anymore. What's up with that?
Well, actually, you know, we were really concerned about PPE at one point. So there's the sewing brigade is out there. So I asked Mary if she would turn my ties into face masks.
Sounds great. Sounds great. Thank you, Ron.
That's a joke. Don't do that, anybody.
So everyone, I didn't mention in the beginning, but at the top right of your screen, there is a chat box. We'll give you an opportunity to ask questions of Ron. I do see that some questions have come in, and I'll go ahead and start with the first question. But if you have any questions, please write your questions in the chat box and I'll ask Ron the question. So the first question is, where are we with testing and what should our local community know about that?
Yeah, great question. I'm gonna plug the PPE effort that I talked a lot about, but also plug Pacific Diagnostic Labs, which is our laboratory. It should have been on my list of things that what did Cottage do to prepare for this? Because I'm not sure what our community would have done without PDL. They immediately obtained 5 of the Abbott machines. You've seen media coverage about the accuracy of the Abbott. We are deep into that analysis, and even in Incident Command this morning, we've got backup systems that make us very comfortable with the appropriate continued use of that. But there are several platforms that were created very quickly, and I'm going to credit Dr. Stuart Comer, who he's another one of those. We are so lucky to have him in our communities. He's brilliant. He's on national panels, and he was instrumental in working not only in helping PDL get set up, but he also works part-time for County Public Health as well, and has helped advise the county on their lab efforts. So, you know, there's, I'm not sure where everybody is on state of understanding on testing. Certainly in the early weeks and until very recently, there was a really tremendous interest in and demand for community-wide testing. And a lot of efforts we went down a lot of roads looking at possible ways to do that. And the more we were educated on this, the less sense it made. And I think right now, we don't know for sure because we haven't done broad testing, but we're probably in a 1 to 2% community prevalence rate. And community-wide testing to find out, with the PCR test, to find out if you have active disease right now makes no sense when the prevalence is less than 2%, because you're going to have to test again in 3 days or 5 days or 7 days. And so I think there's a countywide group of physicians, primarily physicians and lab expertise, who have been meeting weekly since the very beginning of this thing. And so we've really focused our PCR testing around those populations where it makes sense. Certainly for symptomatic individuals on the list, right? We are now doing that for every admission to the hospital. We did a baseline so that we knew that we didn't have anybody in the hospital, because you can test positive for COVID and be asymptomatic. So we wanted to make sure we didn't have anybody in the hospital. This was several weeks ago as kind of a baseline to begin. And so I think what the county is recommending now makes a lot of sense. The state also has set up the county's actually done it, but the state has brought the materials and the support to set up these sites at Earl Warren and in Lompoc and in Santa Maria. And it's interesting. It's on the county website. They promoted it to some extent, but it's underutilized. They can do up to 132 tests a day, and they're not selling out. And so I'm hoping that the community's understanding about, you know, when you should get a test is much better than it was, say, 6 to 8 weeks ago. The other one that, of course, we were hearing a lot about is the antibody or the serology test, which doesn't tell you if you have it, but it can tell you if you had it, and I think, you know, could possibly tell you if you have an immune status. The problem with that, and there may be physicians on the call who can speak to this better than I can, but from what I understand in meeting with our physicians, there is a very high, up to 50% false negative rate associated with that particular test. And so again, with very low prevalence in our community, it doesn't make a lot of sense to do this. You're very likely to find out of all the testing that we do at PDL on somewhat select populations, we are still running a less than 2% positive rate on about 1,500 tests a week. So I hope that's helpful to people. I think that if you are symptomatic, absolutely, you should get a test, and we've got terrific capacity to do that now. If you're going to have a test or procedure at the hospital or at one of the surgery centers, for example, there's a requirement to have a test done within 72 hours of that procedure. So anybody who's scheduled at Cottage is referred out to the tent at Goleta Valley that's been set up to do all that preoperative testing. And we have had some cases where those cases, they're elective, they're not emergent, where those cases have been canceled, really postponed, because we've had some people show up asymptomatic who tested positive.
Okay, great. So Ron, that was wonderful. We have one more question. That question pertains to what we're seeing now is that the curve is starting to slope down. And so someone has asked that we've been hearing about upticks across the US, and with the curve now sloping down, do you expect that there will be a surge in the future?
I certainly don't have the crystal ball on this any better than anyone else's, but I guess, sitting with our infectious disease physicians every day, I think their answer would be, we're more likely to see waves than we are a surge. We've all seen the New York and all the predictive models. By the way, those early predictive models, even when we were seeing increased incidence and prevalence in Santa Barbara and hospital admissions in Santa Barbara, we were working with the county, who's still working to set up a surge hospital facility at the vacated Sears building. And so those early models, we were thinking it was going to be much, much worse than it has, because I believe our community has done a terrific job at social distancing and so far at masking and taking care of not spreading this disease. So I think we've also been really fortunate that we've had only one skilled nursing facility in the county that has had some positive patients. And any congregate living facility is a danger zone for this, as we know. And so there's one skilled nursing facility that had cases I've forgotten the number, in a skilled nursing facility in Lompoc. And it was managed immediately, very well. All the contact tracing was done, all the staff, and they were able to isolate and prevent a nightmare at that skilled nursing. And we haven't seen that in any other of our SNFs. So will that continue to be the case as the community begins to open up a bit? I hope so. But any one of our high volume, high capacity skilled nursing facilities that had an outbreak could result in a surge. We all know what's happened at the penitentiary. We had 1,066 positive tested inmates. Not all the inmates on the medium security side were tested. That's where the outbreak began. And so we were very worried about this. The patients started coming into Lompoc Valley Medical Center. We have the higher level of ICU care, so patients began being admitted to our intensive care units, and very, very concerned about this. I think we have avoided what could have been 60 to 80 admissions that could have come out of there, and a lot of deaths. And so, I think that the wild cards are going to be skilled nursing facilities, whether return to school, whether return to restaurants and businesses. Of course, the activities of the last 10 or 11 days, that is certainly our other crisis nationally. How people respect the need for distancing and masking as they exercise their rightful rights to protest, to make their voices heard. All of these things are more likely to result in in waves. This week, Marion Medical Center, I think on Friday they had 5 COVID patients, and on Monday they had 20. So they don't know what the source is or why that is yet, but it just reminds us that we can't let up on our level of diligence as a community to make sure that we don't have happen here what we've seen elsewhere in the country.
Great, that's wonderful. There's one last question, but it looks like this question is directed towards me.
Great.
Is Cottage research involved in investigating COVID treatments, such as using plasma from recovered patients? And the answer to that is yes, we are very much involved in a lot of the remdesivir studies, as well as the most recent convalescent plasma studies. So we are running many of those studies right now. We are currently not doing any vaccine studies until we get to a level where we anticipate that the vaccines will be safe for our patients. So that's an answer to that question. So Ron, thank you so much for being with us today.
Could I make one more comment, Richard?
Sure.
I want to just make the point that I was so proud of our staff and the response, and I still am, but I did want to just let the group know that we're very aware of the economic impact on businesses in our communities. I'm sure affects probably everybody on this call in some way, shape, or form. And when you asked your first question about how's Cottage dealing with this, our staff also were affected by this, and so we canceled all elective surgeries. We were running at about 50% or so of our normal rate of occupancy and care provision. And so we were able to deploy most of those staff most of the time, but not always. That didn't prevent them from being impacted. They also are married or have partners to people who have been furloughed or lost their jobs. And so I wanted to mention that because we were, and thank probably many of you on this call, because we set up a emergency relief fund, and this community donated so far, in addition to all the donations going to the United Way Santa Barbara Foundation effort that's so important. A lot of people gave money to Cottage for this very purpose. We had people who had unexpected childcare needs. They had to choose between taking care of their child who was now home from school or coming into work. Of course, they came into work. And so unanticipated challenges and needs there. And this community has given $1.3 million just to enable us and assist us in helping our employees with grants that not loans, but really need-based grants to help them pay their mortgages and that sort of thing. And I know that a lot of businesses out there haven't enjoyed the benefit of that and are doing your best to make that work. But we're just very grateful for all this community's done on so many levels, technically, financially. Thank you.
Thank you, Ron. Wonderful. Thank you for being with us today, and thank you for updating us on all the things that are happening in the hospital. It's been wonderful.
Thanks, Richard. Thanks, everybody. Look forward to seeing you all again.
Thanks, everyone.